Welcome to the True North Compliance Podcast, where we discuss regulatory and compliance issues for Canadian business.
Hello, I'm Shawn O'Hara, and thanks for listening. My guest today is Olga Radutsky, who is the founder and CEO of Estedica Global Wellness, a health and wellness facilitation firm that connects individuals and corporate clients with world-class medical, dental, and aesthetic providers around the globe. With more than 15 years of human resources leadership experience across diverse industries, she specializes in employee value proposition design, total rewards, and talent attraction and engagement. Olga has redefined medical travel as a strategic employee benefit that strengthens recruitment, retention, and workforce well-being. She holds a Human Resources Management Diploma from Camosun College and a graduate certificate in Management Consulting from Royal Roads University. Since launching Estedica in 2024, she has been transforming how individuals and organizations integrate global healthcare and wellness into modern life and work. Olga is also accredited as an Advanced Certified Medical Travel Professional. And we'll get into what that involves. So, Olga, welcome.
Hi, Shawn. Thank you for having me.
What inspired you to launch Estedica Global Wellness?
Well, I think there were a few factors that drove me to start this business. In 2023, I had my son. I went on parental leave and I took a natural pause from corporate world, and it really drove me to reassess what it is I want to do with my life, where do I want to move professionally. And coincidentally, during the same time in my life, I was talking to my longtime friend and actually someone who helped me launch Estedica. She spent 10 years working in Turkey as a manager of international medical tourism department in one of the largest chains of very respectable, very well-established, reputable hospitals. And the more I learned about what the industry involved, the positive impact it makes, and the amount of care and precision and quality that goes into it, the more I felt like it was a very strong alignment with my values and what I want to do in my career. I also come from a medical family. My grandfather was a doctor, my aunt was a nurse, and the medical field is very dear to my heart. And I feel like Estedica really is a coincidence of all of those elements, the healthcare, the customer service, the quality, focus on safety. Another big thing for me was looking at what's market lacking, right? What's lacking on the market right now, and that would be healthcare. In Canada and the United States, I think we're both faced with the same issue of healthcare, either delays or really high cost. And I'd say in Canada, historically, we've always been of a mentality that we have our healthcare covered by the government. It's free. Why would I pay? It still holds true. However, the delay is really pushing people to look outwards and look at some options here. And within the last few years, if you notice, there were a lot of private clinics popping up in response to really long wait times for Canadians. So in our case, it's all about wait times through the government system, or if you want to seek private healthcare options, those are very expensive. On the United States side of things, it's primarily the cost. But whereas the United States been operating as a two-tier system, government and private healthcare for many years now, is just starting to come to Canada. And I think it's a bit of a shock to some Canadians that they have to resort to private options. And really, Estedica is here to bridge that gap between wait times and accessibility and making it seamless and making it easy, making it controlled, making it quality.
Could you please tell us exactly what medical travel is and what it involves?
Absolutely. Well, it's known by many names. Some people refer to it as medical travel, some refer to it as medical tourism, medical facilitators, medical travel agents. I personally do not like any of those terms because I think there is a bit of a stigma associated with it, implying that it's quick book and go type event, and it's something that is for those who's looking for a bargain. And it implies that, again, the quality, either where you get there or the quality of how you're being supported throughout your journey, is not really that high. And I think that's one of the reasons why I felt so inspired to start my business, to really break down this barrier of thinking that this is a secondary option. Because really, in its core, it's an excellent way for someone to get potentially lower cost, high quality, same as in Canada or United States, if not higher, and fast access to care. And we're talking anything from medical checkup and diagnostics. It could be something that's very specialized. We've seen patients coming through to the hospitals through us for consultations for cardiology, anything for gastrointestinal issues, orthopedics. Dental is a big one too. I mean, if you lucky enough to have coverage for dental, yes, basic things going to be covered, such as checkups and fillings and maybe some dental work. But as soon as you kind of move towards something that's a bit more restorative and something of a bigger scale and scope, or anything that's purely aesthetical, which is veneers, for example, the price range really it's anywhere from the 20,000 all the way to $60,000 mark. So it is cost prohibitive for a lot of Canadians and Americans to have it done here. And where the misconception lies is, well, if I go to, let's say, Mexico or Thailand or Vietnam or Turkey, it's going to be subpar quality, or I'm not sure what the treatment is going to involve. Well, the truth of the matter is most of the doctors, most of the dentists we work with, they're not just trained and accredited in their country. Most of them are really well versed in international practices. They actually had to go and practice in different parts of the world. A lot of them have certifications or they graduated from different places around the world. For example, I just came from a trip to Mexico where I am onboarding new partner hospital, and as part of that hospital offerings, they also have dental care. And the head dentist who runs his practice there, he has one in Cabo and two practices in Cancun. Well, he graduated from Boston University. So his frame of reference when it comes to quality, when it comes to techniques, to approach, to materials, he works to technology, it's all aligned with North American standard, right? So there is no risk of a Canadian patient going there and finding that the technique is completely outdated or not really at the same level as North American standards.
The perception might be somebody with in the back of a truck with a pair of pliers, but that's not the case at all.
Oh, 100%. Yes, yes, 100%. And that's probably the most exciting things about what I do is being able to educate private clients, corporate clients, how the whole process works and where you go and showing the photos, showing the videos, showing the testimonials, sharing the credentials of the doctors and the hospitals, because that's really important, right? I'm coming from the background of human resources where really my sole focus always does not matter what I do. It's about ethics standards, it's about compliance, it's about privacy, it's about identifying and mitigating risks. So that's kind of in my DNA already. And that's why it seemed like such a great alignment to go into that industry because I can be that fact checker and a guard dog, if you will, for my clients. Really, why people come to medical travel agents, or in my case, I prefer to refer to my business is global wellness because really that's what it is. I don't like the component of travel or tourism, right? It implies it's something that's very lightweight and leisure, right? And that's not that. You need to really take it with, all seriousness. And of course, there is a layer of leisure if this is what the clients want and if they want to spend some time on the beach and a nice all-inclusive 100%. We set all of that up for our clients, and there is an element, not gonna shy away from that word, luxury, to all of our packages, but the core of the product is making sure that there is a quality healthcare or dental or aesthetics services provided.
You mentioned onboarding a hospital in Mexico. Because my first thought was somebody needs a procedure. You go on Google, you find a place that could be, and you say, okay, I can book something here. But it sounds like that's not what you do at all, that you have a relationship.
Oh, yes, 100%. And that is the difference between a client, a user, a patient, potential patient of the hospital going online and Googling versus working with accredited medical travel professional like myself, where people are overwhelmed with how many options available out there. Often people not sure what to look for, who to trust. I have heard terrible stories where on the website it looks like a legitimate place and the reviews check out and everything sounds lovely, and then they show up and it's just a hole on the wall, and they're not sure their kidney is not going to be sold in black market when they're all done with them, right? So that's why people come and work with facilitators, because we provide that layer of, we vetted the professionals. We either traveled there ourselves, walked the facility, spoke to administrators, spoke to the nurses, spoke to practitioners, I even spoke to people who did not know who I was. So, for example, when I went to Mexico last week, they have essentially food court, a beautiful courtyard, and they have, an assortment of different cafe shops there and snacks. And I saw a few people in that hospital scrubs. I mean, I'm a social person. I came up to them, said, "Hey, how you doing? I'm visiting Mexico," and was just trying to strike a conversation. And I would ask them questions around, how do you like working for this hospital? Why do you like working for this hospital? How do they compare against other hospitals in the area? And that was a very neat tool, really, to find out what they truly think without knowing who I was and that I was there to audit, right? And across the board, positive feedback and saying how some misconceptions about Mexican medical system can be true. Yes, some of them might be very much money motivated and driven to up the bill, and how much it was not the case with this hospital. And that's the reason why they choose to work there, where it's all about service excellence and patient experience and customer care, right? So I try, again, falling back on my HR background, I try to deploy multiple tools in my bag to find out really what is going on in the hospital, looking at all the credentials, looking at certificates, looking at procedures. When we were touring, I was asking very specific questions that, again, someone who's just quickly Googling, they probably won't think to ask. Things like, what's your nurse to patient ratio? Which is an important question to ask, because that is going to give me a very good snapshot into how well is my client going to be taken care of during and after procedure. Are there going to be nurses available to tend to them right away, or are they going to have to wait, right? How busy is the hospital, right? What's their standard, right? We went through everything, every area. We went through the bay where they have their sterilization room, right? And they talked me through how they do that and how frequently and how many people are on their shift. So that's the level of depth I get into. And sometimes people who just go online and they Google, they just don't get to experience any of it, right? They don't get to, lift up the carpet and check out what's there. And that's the most important piece, right? How can you trust where you're going when you've never set foot there? And I don't personally visit every single one of my network hospitals, but I have partners who do. So, for example, the lady I was telling you in the beginning, who kind of guided me into this line of work, because she worked for the hospital, chain of hospitals in Turkey, in Istanbul and Ankara. She worked with all those doctors side by side. She knows the nurses, she knows the protocol, she knows the procedures, she knows the patient inflow. So that's what's important, right? Every single hospital we have personal connection to, and that really mitigates the risk of the unknown. Where am I going? Who's going to be taking care of me? It's just a one phone call away for me to say, hey, my client's coming, and this is the expectation, and please keep us posted.
Is part of you're an advanced certified medical travel professional. Is that part of the network where you can support each other and somebody could be familiar with a hospital that you're not, but you know a fellow travel professional? Let me back that up. A fellow medical travel professional would be able to offer a guidance or knowledge about a hospital.
Oh, definitely, definitely. There is a directory through Global Healthcare Accreditation. That's the body that accredits certified medical travel professionals. And there's a directory where you can look up by location or by level of certification because there are different credentials. And absolutely, you can reach out to them. What I'm finding, there are not a lot of services like mine, not a lot of companies like myself, a lot of medical travel facilitators. They try to affiliate and represent one hospital, one or two hospitals, and all of their marketing efforts, everything really is driven by we're going to be heavily promoting this specific hospital, and then any patients who come to us, the hospital knows they immediately assign to us. So there is a bit of a closer collaboration with a specific institution. What I try to build is being hospital agnostic. Yes, I have the network. Yes, we personally know them. We can essentially provide all the information around the certificates or how they operate and what the whole patient journey would be if they went to that institution. But I personally do not wish to be ever in a position where the client says, hey, you sent me to that particular hospital because you affiliated with them and the outcomes were subpar, right? My role, and I need to kind of put a claim here that I myself, I am not a medical professional, right? So there is a very clear distinction what I do and what I don't do. And I think you asked me in the beginning, and let me just put that out there that I do not provide any clinical advice. I cannot diagnose. We cannot do any of that sort of work. What I do is I want to make sure when our clients go somewhere, they have everything seamlessly organized. They can rely on us to vet for quality and for the processes, and we can provide them with options, right? Again, people make mistakes from the place of overwhelm. I have to go. I have, I don't know, for lack of example, a couple of front teeth missing. I have to panic flight to Turkey and get it done, or to Tijuana. Even Mexicans avoid going to Tijuana to get things done, right? So it's really about knowing where to go and where not to go, right? Yeah.
So you don't diagnose, so I can't go to you and say, "Hey, I have a sore knee. I think it's this. Where can you can you tell me what it is and where can you send me?" So
No, no, no,
I kind
no,
of have
no.
to go with the diagnosis and I say, "This is what I've got. This is what I've need. Can you help me?"
Well, there are a couple of ways. Maybe let's back up a little bit, and I can tell you about the three programs we have and three distinct ways we service our clients. So let's start with a private client. If you're a private client, you have two ways of engaging with Estedica Global Wellness. You can either sign up for a membership or you can purchase Estedica Signature Access, which is essentially a one-time engagement you and I are going to have. So let's start with one-time engagement. If it's one-time engagement, you're coming to me, let's take your Thorny example, and you're saying, I think I've got severe arthritis or I need a knee replacement. What I would have, what I would go with you, the very first thing is for us to have a consult. When I'm consulting you, it's not a medical type consultation, it's for you to get a really good feel about what the service is, who I am, because the most important factor in this relationship is trust, right? So I want to make sure my clients are comfortable with me. They understand that I'm going to be always acting in their best interest and that it's very transparent. They can ask any questions they like about the process or about the providers. So when we have that first consult, I'm going to give some options in terms of like, here are the locations we can go to. This is how the process works. If you decide to move forward with that, I'm going to need a medical form filled out. That medical form will contain information that the doctors at the hospitals they will need to essentially assess your condition and to recommend a treatment plan. Depending on the clinic, depending on the doctor, some require us to collect x-rays that are 3 months old, not older than that. Some would like something that's pretty much you getting treatment tomorrow. We need something that's from yesterday, right? Something very recent. So it really depends on the condition, what it is. If it's dental help, it could be panoramic x-ray that they are requesting. Even if it's not a treatment, if it's veneers, which is purely aesthetic, because what the doctors want, dentists, what they want to avoid is to put veneers, right? Set everything up, and then turns out you have cavities and you have a lot of issues that need to be treated, right? Because then how do you get there, right? Same goes for the crown, right? So we would collect medical information, what kind of surgeries you had before, if you had any, if you have any conditions they should know about, if you have any prior surgeries, anything that might be relevant to treatment plan. After that, I would send the quotes out to a few hospitals. Again, depending on your level of comfort, you might say, I don't feel like flying too far, or I only would like to go to, let's say, Europe or Mexico, but I don't wish to travel to Turkey or Cyprus or Argentina, right? So really we try to customize the experience as much as possible based on your needs, your wants, and your ability and your timelines, right? Personal and professional. So after we get the quotes back, then I'm going to provide them to you. Then you can either go, yep, quote one out of the three works best, and then we start planning. Or you might want to have another call with us so we can, talk through options a little bit more. Then you have a couple of options here. We can arrange your travel and your accommodations. Some clients might say, no, thank you very much. I prefer just to deal with all of it by myself, which is totally fine. And then we begin the work. Then we make sure that everything is coordinated. We make sure everything is teed up, right? The doctors, when you're going to be coming in, the translator who's going to be greeting you by the door, grabbing you by the hand, making sure they take you to the right cabinet, making sure that they essentially by your side throughout the whole process. A lot of clinics, a lot of hospitals, most of them going to do pre-op checks, and depending on what the procedure is, they might be less or more involved. Could be something as basic as just blood pressure and blood work, or it could be something very much in depth. For example, if you're going for abdominoplasty or maybe a breast lift or breast augmentation, well, that's going to involve, yes, the blood work, but also it's going to involve x-ray, it's going to involve ultrasound, because they want to avoid any complications you otherwise might not be aware of, any conditions prior to putting you on operating table.
That x-rays and blood work and so on, they would do here with their current medical professionals.
Well, interesting you asking that, not necessarily. That ties in really well into, well, the theme of your podcast, which is everything around compliance. For example, if you're going to Mexico, well, it's illegal for them to not do all the checks and perform all the pre-op routines prior to operating on someone. A great example is a client who wanted to go, well, precisely for breast lift and breast augmentation procedure, and they went there and they said, hey, I prefer just to get everything done here. I don't want to waste any time on any checks, on any more screenings. I just want to get in, have my procedure, get out, go to hotel, recover, and fly back home. That's not how that works there. It's actually legal for the hospital to just grab someone off the street and without any checks and balances start performing procedure. The doctor is actually liable, right? So again, as I said, it ties into regulatory elements of how they operate, and most hospitals are going to be like that, right? Because it's critical to check for anything that might be a threat to patient's condition, right? If they are not aware of something and they, God forbid, go into a shock or their recovery phase is affected because they didn't know that there is some prior condition, right? It's very serious. Then it's not just about protecting the hospital, it's about protecting the patient. I spoke to a plastic surgeon and he shared a story, which I'm happy to share here, about a patient who did essentially what I was just describing, where there was intake form and they listed all the conditions and they said that they have some prior heart condition, but it's all taken care of and it's been treated. And then they ended up arriving, and because the hospital did their due diligence and they checked everything really well, turns out she had a hole in her heart. And they said, absolutely, we're not putting you under, right? Anesthesia is the last thing you want to do in under the circumstances. So the patient had to leave the hospital and go home to deal with that because that's not what they came for in the first place, right? So yes, the diagnostics pre-op is the critical step there. Absolutely necessary. And also considering the state our healthcare is in, I doubt the client would be able to actually go and get something that's not mandatory. Like I can share my own example. I am lucky and blessed to have a family doctor. And when I went to my family doctor and I said, hey, I'd like to do a full checkup, well, the full checkup only involved blood panel. That's it. For something very basic, they checked for some hormones, they checked for few markers, but that's it. And if you want something that's truly comprehensive, something that's truly focused on longevity and preventative care, you're going to be laughed out of medical office because they're going to say, well, nothing is broken, no MRI, no scan, none of that for you, right? Or again, your option is to go through private care channel and have that done there, but the price range honestly sometimes just makes me lift my eyebrows. Anywhere from 3,000, 3,500, all the way to $16,000 here to have a comprehensive, well-rounded checkup. Whereas, for example, if you're going to, well, again, fresh example going to be Mexico because I'm just working on packages. It would be just around maybe over $1,000. That's a huge difference, right? And with that, you're getting everything from X-rays to MRIs to potential markers for certain diseases, and could be anywhere from 15 to 30 on the panel. It's adjusted to your age. Females before 40 and 40 plus, they have different set of things that they being checked for. Men also get different things, and there's more cardio and prostate focus that is added 40 plus, right? So it's really optimized for age of our clients.
That's quite the cost difference to start at 1,000 and be so much more comprehensive. I heard recently that the Canadian medical system is give us a Tylenol and that's it.
And again, when I talk about healthcare, it's in no shape or form me talking about individual practitioners and doctors, because I really do think that they trying to do the best they can within the confines of the system, and it's not the physician's fault and specialist's fault, right? We really did see a very rapid drop in how many people were going to medical school, both for doctors and nurses. And I think it was, I can't remember the publication, but I read an article that in order for us to catch up to a healthy ratio of patients to doctors and patients to nurses, it's going to be another 10 years.
Right.
But that's not really accounting for influx of continuous immigration, right? And aging population. So there are a lot of shifts that I think going to even stretch that further. But I also want to talk to you about another option, right? So we talked about if you come to me for a specific case. Then we have a membership option. And membership option, it's an ongoing commitment, an ongoing relationship, an ongoing service. And the difference is in signature access, we are dealing with specific case. If it's a membership, you're starting with us. First of all, we're going to have a meeting where we're going to identify long-term plans for yourself. Are you looking to get something done that's pressing? Are you looking to do something that's purely aesthetic? Would you like to get into habit of having annual checkups abroad? If you do, where would you like to go? And really trying to fit all of those pieces of the puzzle around your personal and professional commitments. This works really, really well for professionals who need to fast track access to either core medical services or nice to haves. It layers really nicely with any kind of leisure trips that people already want to make, right? Because then we can align it with, again, dental work or maybe medical spa. And by medical spa, I mean even like laser resurfacing CO2 treatments or maybe neuromodulators or filler treatments, really anything. So those are two avenues that the clients can take, private clients. And then we're going into
Does that mean then somebody could plan, say, their twice a year trips away somewhere, their vacations, and then actually have their full checkup?
Absolutely, absolutely. I'm not sure if it's needed, to be honest, doing it twice a year, unless you have a condition that you really need to keep an eye on. I would say even once a year is adequate. But of course, I would never dissuade someone from doing it twice a year if this is what they want to do. But it could be a combination of dental work. It could be a combination of I want to maybe see a specialist that deal with a very narrow niche and could be dermatology, could be again cardiology, could be anything. Another option for our clients is for us to coordinate virtual second opinion, which is also a very valuable tool if you don't feel like traveling, if you don't want to go somewhere, but you seeking expert opinion and second, third advice. It's going to cost you a fraction of the cost of traveling somewhere, but we can connect you with leading hospitals in Europe, in Latin America, right? Again, plastic surgeons also something that we can arrange, dental as well.
That's very good to know, that second opinion, because what we find for those of us who research our own health and conditions is that in Canada or in BC, there's only one treatment that's available, and we know other treatments are, or that there's other research and other opinions being done.
Oh, 100%. And I think you raising an important point here, Shawn, that the reason why medical travel exists, it's not just for the money piece or because people want to get something faster. The third element that sometimes is overlooked is ability to receive treatments using technology that's not available in Canada or just alternative option, right? It might not be technology, but it might be specifically the treatment itself. For example, stem cells. Stem cell treatment in Canada is not legal, and there are only a couple of very narrow cases that it can be applied to. And if I'm not mistaken, I think it's leukemia, one of them. But you need to jump through so many hoops to actually have it approved and have it done. And even when they do it, the methodology is quite outdated. And again, disclaimer, I'm not a medical professional at all, but I absolutely love the subject of stem cell therapy because I feel like it's such a fascinating field where really the future of medical advancement, I think, lies within that area. Very promising results on cancer, very promising results on treating kids, autistic kids, orthopedics, amazing results. People literally walking away with no pain after that. So I really think that those who are looking at some options there, definitely it's worth exploring. And I have a couple of excellent vendors. Again, one in Mexico and another one is in Vietnam. And both of those vendors, they produce their own stem cells. which is really important because you know what's in them, right? You know exactly how they're produced, who's checking them. They have to adhere to very strict set of rules, and usually there are independent regulatory bodies that have to inspect how the whole process works. But yeah, we can talk about it some other time. But stem cell therapy itself is a fascinating field that had a lot of misconception and since then demystified. And now I think there are a lot of really promising things happening in that area.
That's neat. So, what could people do? I'm thinking, what are the different scenarios? Say someone has a condition and they're just, for whatever reason, cost, delay, or lack of access, and they want to know, I guess, about an alternative. What would be their process, or when should they be contacting you, or how would that work?
Well, they can contact us at any time, really. I'd say wait times right now for any sort of orthopedic work is through the roof. A year wait is not uncommon. A lot of people pushing 2, 3 years. So I'd say probably that's a very pressing concern. We would start with what I described, the consult, and then anything the doctors would need to make
So maybe
diagnosis.
my question is, should they go on and do all of their research first and then contact you? Or should they say, this is my condition and this is what I'm interested in, and then you consult and try to match up from there? Or how do you work?
It's a good question. I think it really depends on level of comfort of each client. I think the more educated and informed you are, the better, because again, I am not a doctor. I want to have a conversation around what options are available, what kind of treatment programs they have. But in my experience, most clients who come to see us and they seek help, they already know at least the fundamentals of what the condition is that they have and treatment options available in Canada. And that's primarily why they start looking elsewhere because they either don't want to wait that long or they want something that's going to be not as cost prohibitive, right?
That's neat. You mentioned earlier a translator, and I found that so neat because my thought, and it could almost be a situation comedy. Someone shows up with Google Translate and a sign, knee replacement, and they're in a foreign country and nobody can speak to them. But it wouldn't be like that.
Just pointing at the knee,
Right?
right?
It wouldn't be like that at all.
No, not at all. That's, well, essentially, that is one of the reasons why people would be using Estedica because we try to anticipate the needs that the client's going to have, right? And there's so many things to think about from what's going to happen when you step foot at the airport. There's going to be a driver who's going to be picking you up and they're going to be taking you to the hotel. Then from the hotel, they're going to be taking you to the hospital to have your treatment done. Then from the hospital back to the hotel. And on the day of your departure, they're going to be taking you again from the hotel to their airport. So that's covered. So clients don't even have to stress and worry about, oh my God, I need to research frantically, shuttle companies in, I don't know, Turkey or Cyprus when I arrive, or do I hail a cab? None of that, right? Because what we focus on, you need to be arriving in a very calm state of mind. And any outside noise, any operational logistical minutia should not be even your peripheral, right? That's the reason why you're hiring services like mine, because we need to talk through what are the things that are important to you and we make sure we make it happen,
That's better coverage than
right?
we often get here, where we're told we need to bring somebody to the hospital to advocate, and we hear horror stories about people after surgery. The cab driver drops them off outside their door and drives off, and that's it. So,
Yeah. Yeah, it's an interesting point you bring up because one of the biggest questions I get is how do I know I'm not going to be mistreated, or how do I know there are not going to be any medical errors or any hiccups along the way during my treatment journey? Well, the response to that is the fact that you are being treated in Canada does not mean that you're not going to have same unfortunate incidents or hiccups. And it's heartbreaking how many stories I've read so far about people either just being left not treated properly and misdiagnosed, or just they didn't get timely care, and a very young girl died from sepsis in Ontario. Another one died due to labor and delivery complications. So things like that happen in Canada, they happen in the States, but I think because of some stereotypes and preconceived notions about medical travel, people's ears and eyes are trained to look out and search for those things that did not go well, even though it happens here just as much, unfortunately. And again, it all links back to where do you go? All the horror stories you read about UK patient went to Turkey and had unfortunate complication, and a facilitator never picked up the phone. Or another person went to Mexico and came back with a hole in their stomach because they ended up with necrosis. Well, again, you did your own research. You went to a facility that's not accredited, where they had the bacteria, eat flesh-eating bacteria that permeated throughout the entire hospital, and that's the result of going somewhere where you didn't check credentials, you didn't vet the professionals. Of course, everyone, of course, tries to do their best in terms of research, but you cannot know what you don't know. And you don't know what to look for, right? And horror stories happen, but again, it's largely due to not going to very high caliber institutions.
That's a fascinating parallel, just travel in general, because of talking to travel agents who will say, like when I travel, I use a travel agent, corporate travel, because if I get stuck somewhere, I just want to say, I'm stuck, help. And actually, they usually anticipate and they're on it. But the travel agents will say, there's a snowstorm, for example. They go to the airport. The people have been stuck in the airport for days. They never go to hotel rooms and wake up people sleeping comfortably in their beds because they used a travel agent and because everything was looked after to find out how happy they are. They find the few people stuck in the airport. So I guess this is similar. People think, I need this procedure. I'll do a Google search. I'm booking here, and they have no idea what they're getting into compared to using your services.
Oh, definitely, definitely. And another aspect to this, and I've been seeing this trend growing bigger and bigger and bigger. I think we are stepping into a very interesting period in our lives where we are getting technology fatigue, we're getting app fatigue, we're getting fatigue from go online, book quickly, Expedia, this, that, Match.com and Tinder and Wish and this. There's app for everything. And the element of human connection and boutique services tailored to your specific needs, having someone looking after you as a human, that's what a lot of our clients are craving. They want that one-on-one attention. They want something that's designed just for them, and someone who knows them by their name and gonna call and say, "Hey, Mrs. Smith, this is what we lined up for you," and checking up on them. How was your stay? How was this? How was the hospital? How was your room? How was access to the nurses? How were the amenities, right? All of those things, not just quickly rate our app, tell us how you did. Right? That's a huge element that cannot be underestimated, right? The personal connection we have to our clients.
This has been fascinating. Earlier, you started to mention about the corporate programs. Could you elaborate on that?
Oh, sure. So, how that was born, again, leaning on my HR experience, I saw that there was quite a gap between what the employers offer to their employees that are kind of shiny perks and cool benefits, jazzy benefits, but lacks substance, right? Having pizza parties is great, having beanbag chairs and food tables, excellent. But when it comes to things that are truly making the difference in quality of life, that's why I decided to proceed with building out the corporate services for the clients. And what it entails, it has pretty much the same structure of having either a membership based and it's per month per employee rate that either the employer or the employee can cover, which is very reasonably priced and very affordable. And again, it comes with this proactive planning. It comes with, hey, let's map out your needs and try to build something that accounts for all of your timelines and any of your priorities, personal, professional. And what I'm finding is a huge help is when the companies have either HSA or WSA. So the HSA, it's a health spending account, which can be used towards treatments in Canada or abroad, as long as it has been done at the registered hospital and there's documentation that supports that the procedures were done by a registered licensed institution. The caveat with HSA, it has to be medical procedure. So it has to be either the diagnostics or it has to be a surgery, or if it's dentistry, it cannot be aesthetic dentistry. It has to be actually a root canal, or it has to be implant, something that is more within that like oral surgery medical space. And then WSA, which is wellness benefits, or sometimes it's FSA, which is flexible, or LSA lifestyle, so many names for it. That is essentially amount of money that employees can access, but they can use it virtually for anything. Gym memberships, they can use it even for neuromodulators, doesn't matter. So some employees can draw from both of those and really custom design how they're going to cover their treatment. So we help with that as well, saying, well, if you have, let's say, $2,000 HSA fund every year, well, over 3 years, then it makes it $6,000. How would you like to distribute that? How can we map it out for you that year over year you're gonna have best value? And you're going to align it with your travel plans. So everything just complements each element very beautifully. So that's the corporate side of things.
So could that be used for a company where these may get injured and they go on compensation and then they could be out of the workforce for many months or a year waiting for a treatment? Could this be used sort of as a way to get them into a treatment faster and back on the job? Like from the employer's perspective, not just to offer the benefits, but do they get the advantage of, with their staff, getting them back on quicker?
Definitely, yes, most definitely. I'm not sure exactly how it would work in terms of if it's a workers' compensation board claim, if they were injured on the job. Again, if employee seeks care outside of the network that WCB provides, I'm fairly certain it's allowed. I can see any reason why not. When the biggest value comes into play for the employer, and I think you really nailed it, it's the short-term disability and long-term disability, really trying to prevent that crossover. There are numerous ways employers are saving the money if they are using this program as part of their employee benefits. Well, yes, definitely. It's preventing long-term illness and being able to send the employees somewhere, and they can really custom design coverage for any sort of scenarios on any budget. The employer might wish to say, well, we don't have HSA, but every employee is going to have X amount of dollars for orthopedic coverage, for example. Or I'm in discussions with one consultancy firm, and their demographics is professionals 35 plus, and most of them kind of put the family design plans on the back burner while they were building their careers. So now they have a workforce that is primarily focusing on reproductive needs. So for them, it makes sense to design something, and they want to design something where there's allocated funds for IVF treatment, for example. So really, when it comes to working with employers, I come in, we look at what they currently have, what they don't have. We look at the strategy in terms of retention, in terms of attraction. We're looking at demographics and the needs of the workforce. And then we can either have something that's going to be fairly flexible without really designing anything outside of that. So the employee pays X amount of dollars per month, or the employer does, really depends what they want. Or we establishing a fund, and then all the employees know. So as I mentioned, the IVF case could be one of the cases. Construction companies, they might have funds allocated to orthopedics specifically, or a manufacturing facility where there's a lot of that manual dexterity and a lot of, spending time on their feet. Also, orthos to be one of the prime focus areas for medical care for that employee group. So when it comes to working with employers, we educate them on all the savings they might have indirectly and directly. When employer designs and launches HSA plan, I'm not sure if you knew that, Shawn, but the funds are not taxable for the employee. It's not considered to be a taxable benefit. So if the employee commits to $2,000 per year fund, the employee gets $2,000 per year. And at the same time, the business owners, they can write it off as business expense. So it's a win-win scenario for both the company and the employee. And then when it comes to short-term disability, if you see the surge of claims coming, it's not only indirect cost you pay by absenteeism and longer sicknesses and having to find someone to replace and train and everything associated with it, but also your premiums go up. The more claims you have, the premiums go up. So there are a lot of different reasons why that would potentially really work in employer favor financially.
Is it helpful for you to connect with people involved in implementing benefit programs for employers?
Oh, most definitely. Yes, I actually have partnerships, active partnerships with group benefits advisors who want to, well, essentially distribute our services as a
Great.
product.
So that's great. So your contact details will be in the show notes. So if anyone listening deals with benefits or knows somebody who does, I'm sure you would welcome an introduction.
Absolutely. Thank you.
You're certified and as an advanced certified medical travel professional. So that's, I guess, a voluntary compliance because people can do what you do without being certified. So are there any, or so that's a voluntary compliance. And are there any government bodies, like federally or provincially or anywhere that regulate your industry?
That's a good question because since we're not part of medical care system, healthcare system, no, we do not get accredited or checked or governed by any bodies in any way. But I think there are standards of professional conduct, ethics standards, privacy. Again, I'm gonna go back to my professional background being in human resources. It's all about compliance. It's all about checking appropriate certifications and appropriate credentials. In my view, one of the most critical elements of being in this field is handling personal health information appropriately. And for all of your listeners, what I use, it's actually a Canadian company called Jane app. A lot of us use that for booking with practitioners here in Canada, and they're actually international in Europe and in US. So this is how I manage it. I manage it proactively. I don't have to be told. I don't have to be policed by governing bodies in order for me to see what makes most sense from the ethics and privacy protocols. But when it comes to working with clinics and hospitals and the surgeons, that's where the biggest part of compliance comes into play, I think, because even though each country and each hospital, they might have their own kind of certification and accreditation, there are some that are overarching across multiple locations, one of them being Joint Commission International. So if any of your listeners want to go and do their own research, typically when the hospital is accredited with GCI, that means that they passed one of the highest levels of standards in terms of quality. I also look at whether or not they are ISO certified. Some are not. It doesn't really necessarily point to hospital being subpar if they are not. It's a very specific certification, international standardization organization, and some could be environmental, some could be quality, some could be healthcare. Then there are different associations they might be part of, such as American Society of Plastic Surgeons, or it would be equivalent of that, but locally in that area could be issued by Turkey or by Argentina or by Spain or by Germany, depending what it is. But yes, it's always about looking at what kind of certifications they have, how valid they are, how much merit they hold, how long they've been certified, and are they good at upholding that standard.
Wow, that's very thorough. Thank you, Olga. This has been absolutely fascinating. My guest today has been Olga Radutsky from Estedica Global Wellness. And Olga, how can people contact you?
You can contact us directly by going to our website at www.estedica.com, or you can give us a call at 1-250-884-1835, or you can find me and add me on LinkedIn, Olga Radutsky.
Great, thank you. And we'll put that into the show notes.
Perfect. Thank you so
Thank
much.
you. And that's a wrap.